Welcome to our almost weekly REBT 3-Minute Therapy podcast. REBT is Rational Emotive Behavior Therapy, a mode of therapy devised by Albert Ellis in the 1950s that revolutionized the psychotherapy movement from the more psychoanalytic Freudian model, talking about your childhood, to the current cognitive behavior model, where we say that our emotions don't come from situations like our childhood, but they come from our thinking in the moment. And we'll discuss more about that. I'm Dr. Michael Edelstein. I'm a clinical psychologist and author of the self-help book, 3-Minute Therapy, which is all about REBT. And I have a clinical psychology practice on Zoom, phone, Skype, FaceTime. So I'm available for therapy. Today's topic is what REBT is not. But let's start with what REBT is. REBT is a very efficient means of therapy, and it teaches you to be your own therapist. But it's not an immediate cure. It's not a silver bullet, not one trial learning. It involves internalizing a realistic belief, a realistic view of yourself, others, and the world. And in order to internalize that, that takes practice. So it's a matter of working on the approach yourself and identifying your unrealistic thinking and questioning it, challenging it, and contradicting it. REBT is not superficial. It teaches you a profound philosophy of life. You learn an entirely new perspective on yourself, others, and the world. So it is very, very powerful and all-encompassing. It's not an end in yourself because it teaches you a method, an empirical method for uprooting your emotional and behavioral difficulties by getting to the root, by getting to your irrational beliefs that causes your emotions. It's not intellectual. It is based on thinking, but our thinking is what causes our deep emotions. So we start with emotions. What disturbed emotions do you have that you'd like to change? Anxiety, depression, anger, guilt, and shows you how to change that. So it arises from our intellectual functioning, and we focus on our intellectual functioning, but that has deep implications for our emotions and our thinking and our way of life. It's not a process for engaging the deep, dark unconscious, as Freud postulated, but most of your irrational disturbance-related thinking is something with some practice you can identify, and it's usually in terms of demands: must, should, supposed to, have to's, demands you put on yourself, others, and situations. And it takes this form: because I prefer to do well, I absolutely must, and if I don't do well, then I'm a loser. Because I prefer you to treat me well, you absolutely must, and if you don't, you're a loser, you're no good. And because I prefer life to go well, it absolutely must. It's awful if it doesn't, and I'll be miserable forever, and I have to escape in addictions or procrastination. So to summarize, in order to change your emotions, look at your thinking and work on changing your thinking. I would like to conclude by asking you to comment below if you have any thoughts about this discussion. Give the YouTube a thumbs up if you liked it. Suggest subjects for future podcasts. Volunteer to be a guest, and we'll cure you of any problem that's bothering you. Donate to Patreon to support the podcast, and subscribe to the 3-minute podcast, the 3-minute therapy podcast, to stay on the rational side of life.